Good morning, good afternoon, and good evening. My name is Beata McKenzie. I'm the co-owner of Beecura. We are the manufacturer and distributor of Beecura System, which is currently the first and only medical device certified for medical beehive air therapy. We're certified across Europe, Switzerland, Turkey, and the UK at the moment. And I'm very honored to be speaking with you today about medical beehive air therapy for anti-aging. First, I wanted to have a look at what does anti-aging actually mean. And according to the dictionary, anti-aging are substances that are being used or intended to use for limiting or preventing the process of aging. If we look at the beehive, we have many fantastic beehive products available that are beneficial in the aging process. And we have many honorable speakers over these 2 days going into further details with scientific studies and further insights. I will be focusing on beehive air therapy. Beehive air is probably the least researched and studied product from the beehive. However, I'm pleased to say that over the last couple of years, that scene has changed, and there have been scientific studies conducted on the components of beehive air, which is brilliant because now we have these scientific studies on the components of beehive air. We have a medical device to extract the beehive air, and next we need scientific studies that can be conducted on the benefits for humans and animals on any conditions that being presented, and that's really exciting news. I also want to look at the different types of beehive air treatment. Beehive air treatments have been provided for centuries and are very well known in Eastern Europe. There are two different, or I categorize it in two different areas. One is wellness and the other one is therapy. In the wellness category, it's great for the general well-being. You feel really relaxed and can be provided by beekeepers or naturopath practitioners. And mostly you will have probably seen bee beds or inhaling beehive air inside or outside a bee house. It's not a medical treatment and no medical claims can be made. However, it's great for a wellness experience and apitourism for the region. The therapy side, on the other hand, is a medical treatment, and that means you must work with a medical professional and have a bee-proof room available to ensure that the patient is separated from the bees directly. You have to apply to the highest standards in your apiary and your beekeeping, as well as the highest standards in your medical beehive air therapy. There are anamnesis questionnaires that need to be completed, patient questionnaires, and a risk management needs to be conducted too. What is beehive air recommended for? Well, anything to do with the upper respiratory tract, really. The most common ones are the first three, really: hay fever, asthma, and COPD. It's a chronic lung condition, but also things like bronchitis, chronic headaches, depression, long COVID recently. So the list goes on. Now looking at the requirements for the apiary and beekeeping in a little bit more detail. We're looking at it from an all-round view. So we're looking at the characteristics and origins of your colony, the resources you use, how hygienic you are in your apiary, the bee wax cycle you use, the feeding process you use, varroa treatment, as no chemicals can be used for this, and getting your therapy center certified. Why is that all that so important? Well, it's really to keep the beehive air free from any contaminants or any substances that could negatively influence the quality of and the benefits of beehive air. The person that's inhaling the beehive air has to get the best out of it. That's why now we're looking at the patient treatment requirements. So I mentioned bee-proof room. So no direct contact with bees. You cannot 100% exclude the risk of being stung, but you have to minimize it as much as possible. And that was part of the concept that we had to provide in order to get our device medically certified. There are different requirements as well. So beehive air therapy is seasonal. You can only do Beehive Air Therapy during bee season. So in the Northern Hemisphere, that's between April, May to September, August. August, September, and temperatures of 15 degrees above and no rain. And the same principle applies in the Southern Hemisphere. So it's spring to end of late summer and temperatures above 15 degrees, and the bees need to have a good amount of flora and fauna to forage on. We have two types of use cases. One is personal use for yourself and your family, and the same beekeeping requirements apply as I mentioned just before. However, the treatment is done at your own risk and responsibility. You wouldn't take any payment for providing your air, and it's not a medical treatment if you're not medically trained. The other case is a business case where you're treating patients, and this is in a form of therapy. You need to work in collaboration with a medical professional, and they would do a first assessment with each patient. They would set the number of treatments the patient needs, and they would also invoice the patient after the treatment cycle. What's the process before the first session can be conducted? Well, the patient would see the medical professional first. They would examine them, do an anamnesis questionnaire, and also conduct a 10-minute breathing test with the patient 24 hours before the first session can take place. And this is really to ensure the patient doesn't show any allergic reactions. The medical professional doesn't need to be at every session. Therefore, we have the staff in the therapy center. The staff in the therapy center is responsible for coordinating all the appointments and making sure the therapy center is kept clean and in working order. And they also need to be trained in first aid. So they need to be trained specifically in how to deal with allergies and anaphylactic shock and how to administer first aid for that. We have first aid kits available in each of the centers. And though we never had to use any of them, you have to be ready. This is just an example of the anamnesis questionnaire that we've developed with our medical team. This is the patient questionnaire that we get patients to complete. So they would tell us what condition they came with in the first instance, how they felt before they first started the treatment cycle, and then how they felt after they completed the treatment cycle. And that gives us a fantastic view and analysis over time on different conditions and how well patients benefit from Beehive Air, how many sessions they need on average. It gives us a really good first indication in terms of starting scientific research. This summer, we also launched an online tool for patient data management and appointment setting. Currently, it's only in German, but we are hoping to launch the English version early next year. And this is where all the documents I showed you just now are therefore in electronic version. Also, the center manager can book the appointments electronically for each of the beehives so that you know exactly what patient sat on what beehive at what time to ensure if any was ever to happen, you could follow the line through right to the end. And that's really important in these high standards and getting closer to getting the approval from the general medical industry. Now, I also wanted to share some examples of use cases with you today. So let's have a look. So first, I've looked at some of the patient questionnaires that have been completed. Here is a set of 32 patients. Here we asked them, as I said before, what was your condition? How did you feel that the treatment actually helped you? And it goes from really significant improvement, slightly improved, had no improvement at all, to I deteriorated. And it's very great to see that 20 of the 32 patients had a significant improvement in their conditions, even with almost half of them only had very little treatment sessions. Slight improvement for 8 of the users, which is still very good, but the number of treatment sessions is very low. So, the more sessions they get, that result could change also. And then no improvement in 4 patients also. If we here look at for example, in the middle, asthma and COPD, chronic lung condition cases, that number is way too low. So that they didn't show any improvement, that was 100% expected, because for these kind of chronic conditions, you need at least 12, if not 25 sessions to start seeing a slight improvement. And then you look at what improvement we're looking for. You always want to see what's the goal of the patient. It's not always that their condition is completely gone, but has their life expectancy improved? Has their well-being improved? Are they coughing less? What is it that they're actually taking Beehive Air for that really made a difference? But most important was to see that no one actually deteriorated by using Beehive Air, and that is the key. I then looked at the different use cases here: COPD, COVID, asthma, and hay fever or pollen allergies, and looking at how did the patient feel. For example, if we look at COPD, how did the patient feel before they started the treatment sessions? How did they feel after the treatment sessions? What was the number of improvement? How did that change? And then the number of treatment sessions they had. And despite, it's just a small fraction of people that I looked at, the improvement is consistent. So they felt really not so great before, and then they felt an improvement. And that level of improvement is quite consistent. That's fantastic to see. Here are also some other examples of use cases. So we are treating patients from around 3 years to 95 over the last couple of years. We had a long COVID case, shortness of breath. This lady had several hospital visits, rehabilitation center visits, and her oxygen saturation actually reduced to 78%. And she presented that number before she started the treatment cycle with us. With 36 sessions, we managed to get her back up to 89%. And that is just wow, with very little coughing. Her life quality has massively improved. We had 2 males with hay fever, different types, I would say, of how they presented themselves. Both had a smaller number of sessions. One is 12, one is 6 sessions. And both, after a very short number of sessions, felt an improvement in their condition, if not even the condition had completely vanished. We also treat children. As I said before, here we've got, again, 2 hay fever cases. We had a lot of hay fever cases in this year, and very extreme this year with itchy eyes and inflamed cheeks, blocked noses, and with a small amount of sessions, these children are completely, symptoms are completely gone, and they could enjoy the rest of the summer without having to take medication, which is really brilliant. There was also a 78-year-old female with chronic cough condition. She needed oxygen support. Her oxygen saturation was down to 87% before she started Beehive Air Therapy. And with 12 sessions alone, she already got back up to 98%. And these kind of percentages, these measurements are all being conducted by the medical professional. So we are providing the air, and the medical professional suggests the sessions and regularly checks in with the patients. Here's another example of a male 60 with chronic lung condition. And this was quite interesting to me because this is a probably 3-year cycle that this person had Beehive Air Therapy. Presented with COPD, so had several lung infections from 2015, and got to a point where he had to permanently walk around with a oxygen bottle, and life quality had really gone down. He heard about Apitherapy. He started taking honey and propolis products very regularly, and because he couldn't afford, or he didn't want to afford, going to a therapy center as many times as he would need to, he bought himself a device for his back garden, Beehive, and did the breathing sessions in his back garden during the bee season. And in the first 2 years, he did that almost every day. He had regular checkups, annual checkups with his medical team for his COPD. And before he started any alternative treatment, he was classed as golden stage 3 because he had the oxygen bottle. So there's only 4 stages. But with the Apitherapy treatments and products, he, over this long time, 3 years, he has been downgraded to a gold 1. He does not need the oxygen bottle anymore. So sometimes he does need a bit of oxygen, especially at night. But his conditions and his life quality has massively improved. It helped him with his exhaustion and tiredness, and he now has to use rarely any oxygen support. And these are kind of examples, though they're not scientific, they give us hope that when we start doing the scientific studies, that we can scientifically prove that this is working, that it's not just what people tell you, but what you see. It's fantastic. And I could tell you so many more stories, but it's fantastic to see how the bee products actually make such a difference in people's lives and the quality of life to extend their life expectancy. Now, just to summarize, the medical beehive air therapy is really to improve your well-being. That's what we want to get out of it. We want to raise the profile with the medical certification to get beehive air therapy accepted and recognized by the general medical industry, and have now the opportunities to start having clinical studies on the benefits of beehive air on humans and animals. So that's really going to be the next step, and it's very exciting. Thank you very much for listening to me today. I'm ready for your questions. If you don't want to ask your question now, or you find your question later on, you can email me or WhatsApp me any question. I will be happy to answer as much as possible. Thank you so much, and enjoy the rest of the conference. Thank you.